All right, so three-way hip mobility, and I've got a ball here, and it's about the size of a softball, so I believe that's about 120 millimeters, but we want to use something bigger than a tennis ball and a lacrosse ball so it doesn't get lost basically in the ground. So what we're gonna do here is we're gonna take the ball, I'm gonna sit it under my right bum here so you can see what's going on, and basically what I'm doing is I'm putting it where my piriformis is. So I'll put a picture right up here so you can see exactly where that is. And from here, what I'm going to do is I'm going to do something called the dead leg. And what that means is I don't want to have my leg up like this, and I also don't want to have it straight and contracted. What I want to do is have it turned out a little bit and completely dead, so no tension. My left leg in this example is going to be my movement leg. So what this allows me to do is as I go slowly right to left, it keeps the tension out of the muscle that I'm trying to work. Now, you can also go up and down, you can go in a circle, you can do whatever you want, but because a roll usually goes, we say north to south, a ball is nice to go east to west. It's kind of switching up the massage motion to where the physio might use his forearm on your quad. This is more like using a thumb going left and right. That's why we like to use the ball. So from here, I'm just gonna continue to kind of work and release that tissue, always trying to breathe from my diaphragm, so my stomach should get fat as I breathe. And then when I kind of felt that area release a little bit, you're always more than welcome to kind of move about and search around. But when you feel that area has released or it just doesn't really bother you so much, what I want you to do is, since the ball is on my left side, I'm going to go on my left elbow here. And when I'm on my left elbow, you notice that my hips rotate a little bit. Be very careful here, not sticking your hand on your knee and rotating your hips at the same time. It's totally okay to move from here to here if it's more comfortable, but make sure your hips don't rotate because we need the ball to stay in that second location. And so from here, I'm going to continue the movement. It's going right to left, again, up and down in a circle, whatever you want to do. But you're going to realize this area is probably going to be a bit more painful. Now, you realize I'm still able to talk and easily move through it. So if you're finding that this is extremely painful for you, then that shows why you're probably having some back pain or some at least dysfunction in the hips. If it's too painful, you can either switch to a lighter ball, or what I usually suggest is put a pillow under the ball, get on a better carpet of some type, or just do something to lessen the pressure of the ball in your bum, yeah? And so the third position, so okay, going quickly over here, I'm also able to keep my hand from here to here if I want, because I'm not rotating my hips. We don't want to see that yet because the third position is here. You realize now I completely turn my hips over. I like to tell people to keep their knee on the ground. Many times this is a tight position, so people like to contract that leg. Try not to do that. Try just to roll from this position like that. And so the third one is going to be right in here. Again, you're going to always try to be breathing from that diaphragm. I like to tell the people to try to focus on having this knee on the ground, then we know that area is relaxed. And you just kind of want to go through this motion until you realize or until you feel that the hip release or relax a little bit. Again, if that's not possible the first few times, that's okay. You just want to make sure you're not fighting too much because that also won't bring our tissue into a relaxed position. So if you are fighting too much, do something to change the surface of the ground so it's a bit softer.